Welcome to In the Zone with Chris Zander, where we talk lifestyle, entrepreneurship, self-care, and much more. So go grab a drink or a snack and come on back because it is now time to get in the zone. My guest today is a medical physician who took the entrepreneurial route in opening his own practice, Members Health Co. here in Nashville. Here today to talk all things medical and many of the benefits his company has to offer Nashvillians is Dr. Rahul Iyengar. How are you, Dr. Rahul?
Hey, good. How are you? Thanks for having me on the show.
Yes, absolutely. I can't complain. I want to start here because obviously you are in the medical field and we'll get there, but I want to talk about this because how did you start? What is your story? What were you like as a young person before you got into the medical field? What was life like?
Of course. Gosh, as a kid, I was all over the place. I was doing the most, which I still am. But I was more of I was a science art person.
Yeah.
So I always grew up doing mainly art, and but I was also good at science, and I wanted to help people. So I was also good at test taking, so that helps with medicine. So I was actually between architecture school and medical school. I ended up picking medicine. Very much was the art of medicine is kind of what led that to. But and the more I got into the medical field and training and everything too, it helped just kind of put into perspective that clinical medicine is here, and then healthcare is this giant bubble.
Yeah.
And I'm oh, what's going on in the rest of the healthcare field, so to say. So while I was in medical school, I did a master's in healthcare administration as well, just to kind of learn more about the system. And that's when I learned, it was pretty eye-opening too, of oh, wow, you guys don't really know anything about clinical healthcare, and it's all kind of comes down to the bottom line. It's more business-oriented, and that's really what kind of inspired me to do what I'm doing now. But it's a frustrating system otherwise. So I was what is going on, everyone? This is crazy.
Yeah.
So just interesting, the context of it all, healthcare and clinical medicine and all of it, doctor-patient stuff's in this little bubble, but then there's all the admin, insurance, and pharma, and whatever it is. And I'm oh, and then government, there's just a lot of layers. And yeah, that's what was interesting, just kind of the journey of seeing all the layers too, and the perspective and context of it.
So did you realize at that time that there were so many avenues within it? Because, oftentimes when we're younger, we're thinking, I think this is the direction I want to take. But we don't think about, okay, there's so many different avenues within that direction.
Oh, yeah, I had no clue. Literally, when I was a kid and stuff, I was my parents are immigrants and stuff too. So it was more of we were not a business family growing up at all. I didn't even know business really existed. If I had known that, maybe I would have done more entrepreneurial stuff even younger, because I've always been more entrepreneurial in nature. But that's what I was more okay, I'm good at science. I like helping people. I guess I'll be a doctor. But there's so many other sectors and avenues in the healthcare space to have such a big change on people too. That's what I was interested in, public health, public policy, all that kind of different avenues where you can impact millions of people. And I love the one-on-one too with the doctor relationship too. But it's just tough in the healthcare system where I'm lacking on both. If I practice in a traditional insurance-based system where I don't get that one-on-one relationship, nor do I actually get an opportunity to help the masses, so to say. Which is why I started my clinic now. I'm finally I can do it the way that it's supposed to be.
So with that being said, when you went to school, what was that transition like in school? How was that, taking the classes, the experiences of that? What was that like at the time? Because you went to 3 different schools, right?
Yeah, I went to UCLA for undergrad. That was a lot of fun. I'm not sure what I really learned in undergrad. It was fun. I had a great time. I was a psychology major, which I really did love, though. Yeah. And it was just great to learn about more human communication.
Undergrad's actually just for fun,
but
right?
It's just for fun. Yeah. Expensive piece of paper for fun, but I hope I learned some good communication skills or something in there, and I had a good time. And then I went to University of Miami for medical school, which was also an interesting place to be for medical school, living in downtown Miami and all of Miami. So it was interesting.
Yeah,
but
probably never a dull moment.
No, I was I was I want some nature. I want some LA. I was in the rock climbing team and stuff. I had to get away from the city if I needed to. Miami, I was if I get in a car and drive, I'm in the middle of the Everglades. There's nowhere to really escape to. But it was a good airport. I used to hop to whatever country for the weekend, and it was cheaper than staying in Miami. So, but no, it was. And then my master's from UCSF in San Francisco. So I used to fly to San Francisco every few weeks when I was in Miami. At the same time. And then lived in Austin for a little bit, Montana for a little bit over COVID, and then here in Nashville for residency.
Yeah, so what inspired you to move to Nashville? Because like a lot of people are moving to Nashville, and we talked earlier before this started, like you loving Nashville based upon where you've lived and experienced before. What made you make that move to Nashville?
I mean, I got lucky. Medical field, you don't really get to pick. It kind of picks you. So even like medical school, University of Miami is the only one I got into. So I went to University of Miami. In residency, you have options to kind of rank, I guess, where you would like to go.
Yeah.
But even then, it's kind of like the system just kind of picks it for you. So it just kind of put me here.
So you ended up at TriStar Southern Hills as well, right?
Mm-hmm, yeah.
So what was that experience like? My father actually worked there for years.
Oh, no way.
He's no longer there, but he was a radiologist.
Okay,
so,
I know that.
Yeah,
cool.
Yeah.
Okay. Yeah, it's just been, I mean, I guess he probably worked there in the last, like, before health insurance was a huge grip on industry. Yeah. That's probably what's been surprising between, like, me wanting to be a doctor growing up and then versus, like, even in training, kind of seeing, like, wait a minute, once all this, like, admin stuff, and then now in residency of, like, oh, yeah, it's all, especially in outpatient and primary care, I'm like, oh, I am so frustrated. I'm like, my question normally is like, oh, it's like whatever your symptoms are. And it's like, all right, what insurance do you have?
Yeah.
And depending on your insurance, I'm like, okay, well, they're not going to cover the best treatment you actually need. It's like, so you got to try the other one for 6 months and you got to fail it. And then I can try to appeal and try to, whatever it is. And it's like, again, I'm like, what is this? Like, this is not what I trained for, to learn, like, whatever it is, like the third, fourth line medication that we have to fail before you can even appeal to get the one you actually need. Same like imaging and all that kind of stuff too. I'm like, you need an MRI, but like for insurance, we got to get the X-ray first, and then the X-ray, maybe we got to go get the CT scan after that, and appeal, and then maybe they'll cover the price of the MRI, like, and that'll be like 6 months later.
Yeah.
And it's like, again, I'm like, that's not what I trained for. So that was what was interesting in training too, of just like, I didn't train for 11 years to be an insurance monkey of like, based on your insurance or whatever it is, like I'll do certain management or even if you're uninsured too, all the prices are just so inflated. And that's what's been really eye-opening the last 2 months, having my own clinic open, of like, oh, I mean, I always knew it was inflated. I didn't know it was this inflated. Like doing all the lab work, imaging, everything, like it's all actually cheap. And that's kind of in the context of like the healthcare being this giant thing. I'm like, oh, that's why healthcare in the US costs $4 trillion. It's not because like, oh, doctors get paid a lot. It's like, that's not even where, that's like 1% of whatever the costs are. It's all going towards like admin, pharma, and like all these big like hospital monopolies and stuff where they end up keeping that really, really huge 100% profit margin. And
essentially, like you just stated, a lot of people, you do hear all the time, people are saying, oh, these doctors are getting all this money and, you know, they're just seeing me for 5-10 minutes and, you know, they're throwing me off on the wayside. But what you're saying is it's more than that, that we as regular people may not understand from the medical, you know, side of things. Yeah.
Yeah. And that's what it's frustrating on the doctor side too. I'm like, again, we trained for so many years of our lives. And it's like, I wanted to spend more than 5 minutes with you, but I don't get to make my schedule in the system. It's just someone, like office manager coming in, like, all right, well, now you got to see 30 people a day. It's like, oh, now we got to see 35. And it's like, why? Like, oh, well, the insurance reimbursements got cut for your visit. So you have to see more so that they can keep the bottom line. Not that my salary changes at all. It's so they can, productivity wise, I mean, make ends meet, and all the kind of different contracts that they have. They're all just kind of arbitrary. But again, I'm like, this is not what I signed up for. Like I wanted to go into medicine, like when it was old school medicine, like of like, the doctor's like part of the community. They know you. They're available for you. Not like, oh, sorry, your PCP's like booked out for the next 2 months. Like go to the urgent care. If it's, and of course that's out of network and stuff like that. And it's like someone there that's also just spending 5 minutes with you. And again, I think healthcare as a big ecosystem is very much trying to progress towards like, we need more like AI, technology, efficiency and stuff. And like my whole concept too is more of like, I actually want to go more old school, so to say. Like I want time.
Absolutely.
And if I have time, like I can actually save you or patients a lot of, I mean, extra just money, time wasted, medical errors, all of it. Again, if I have time to actually know you and be available for you, I'm like, I can keep you healthy. And it's a lot cheaper and easier to do that than to, I don't know, wait and put off minor things and eventually go to the doctor like 5-10 years later. And then you get a 5-minute visit with someone. And it's like, what's that going to do for anyone. Like all my patients I used to see, I was like, I wish I'd seen you 5-10 years ago. We could have prevented all of this. So that's what I've loved is now.
Don't even think about that either as well. And I'm just curious to know from this standpoint, where is the medical field going in the next 5 to 10 years? Because like you said now, there's so much more to it that it's just not focusing on someone's needs seems like that's just not even that's not a thing anymore, right?
Yeah.
A lot of people are feeling that too. Patients are feeling that. Even employees are feeling that as well. So where is the medical field going within the next 5 to 10 years that people should be, I guess, more aware about?
Yeah, I mean, I really think it's kind of heading towards a breaking point, which I think is a good thing. People kind of waking up and like, what is health insurance doing for me? And because they have all these arbitrary clauses in terms, like I've had a few friends where it's like, oh, yeah, this hospital's in network. And then they end up going there for something. And then the doctor they saw that day, though, was out of network. And stuff like that, where they still find ways to deny it. And it's like, what are you be all paying for? When in theory, like insurance really is meant to be catastrophic for people that are healthy. And like, if you get hit by a car, you need a major surgery, that's what it should be there for. And people are paying a lot of money for, I guess, just regular insurance plans or premium plans. I'm like, what is it doing for you? And for most people, it's not doing much at all, actually. And even, I guess that's what my whole goal of my clinic is like my membership cost is it's reasonably priced. I try to keep it just, again, accessible and more affordable. And then partnering with a catastrophic plan, like that's still cheaper than most marketplace insurances. And then it can keep you healthy. And also if you get hit by a car or have a major surgery, you're also covered. But more trying to introduce that as an option. I think right now is more of a breaking point. People are like, either you pay a lot of money and have insurance, or your employer's paying for it, or someone's paying for it, or you're uninsured. And it's like, there's options, and I don't even know it was an option, to be honest, till I started my clinic.
Yeah.
And that's even for me, I've loved it. It's the only way I can practice. But honestly, towards the end of my training, I was like, well, what am I going to do? I do not want to take a job seeing 35 people a day, so I have to figure out another option. Is how I kind of stumbled into this kind of a model.
Yeah.
But that's my biggest goal too. I think we're going to reach a breaking point in the next few years. And again, just trying to, when it does break, of like, hey guys, there is this option that will save you money and keep you healthy. So it's more just like, why is no one talking about this? It's
absolutely.
been crazy of like health insurance wise. I'm like, wait a minute, like, I don't know, especially in the last like I'd say maybe 5-10 years. So like they've really kind of like, I don't know, tightened up on like, oh, we're not covering that. Like, oh, no, we're not going to do this. I'm like, oh, okay, the reimbursements are cut. I'm like, who's keeping them in check? Like, they're just kind of, I don't know, make it a big of a monopoly. It's kind of like, again, but it's like being a doctor training. I'm like, why am I listening to you guys? Why am my medical decision-making being based off of your insurance status? Like, that's not healthcare anymore. That's just like, I don't know what it is, to be honest.
See, can I be honest? I didn't even know that doctors dealt with that. Because I'm not a doctor.
I know, that's what it's.
And I think that it's great that you're here today to break this down, because a lot of people don't understand what you guys go through. As physicians as well. You know?
So in the traditional, let's say you go see your traditional primary care at like an insurance-based clinic. Like if I was working there, I'd be seeing 35 people a day. Most of them are sick, because that's why, again, it's a very much a reactive system where people wait till they're sick and then they go to the doctor, because that's kind of just the culture we have currently around healthcare. And then so I'll be seeing 35 mainly sick people a day. If someone healthy comes in, I'm like, oh, what are you doing here? And it's like a weird almost mentality of like, you don't really see that many healthy young people. Or if you do, I'm like, oh, you're just here for annual physical. And it's like, wow, what a nice break from all my other patients that are really actually sick.
You say you don't see that many healthy young people? What does that mean?
Well, so that's what I was like, I think that's my whole goal of my clinic though. I was like, come on in, like younger, healthy. I'm like, let's keep you healthy and make it easier, more accessible. And that's the issue. It's like, even for myself, like trying to get into my primary care doctor, I'm like, they're booked. And I'm like, I'm not going to go schedule. And it's like, there's like, oh yeah, they're available on like Tuesday at 11 a.m. I'm like, well, I'm busy at work then. It's like, oh, well, the next appointment, it's like 4 months later after that. It's like, it didn't make it very inaccessible. And again, it's like, I feel good. Why am I going to go sit there? I know I got to find parking. It's going to be a pain. And then I got to like wait in the waiting room. I'm probably going to get sick in the waiting room, all the kind of stuff.
Because you don't know what's in the waiting room. You don't know who's sick with what in there.
And then I know I'm going to sit there and wait, and then find the doctor will rush in for 5 minutes and be like, not even listen to my one minor concern, because they're going to be like, you're healthy. And it's
Yeah.
like, well, it is bothering me, this minor thing. And it's like, but again, the doctor side, like, yeah, but compared to other people that are, I don't know, I got to send that person to the ER, this person, the EKG is completely abnormal. And it's all just kind of like risk management. It's almost kind of what it feels like, where it's like, if you're doing okay, I'm like, we'll follow up with you in a few weeks. And again, it's like, I feel like a lot of times you go in there with the mindset of like, am I going to write you a prescription or am I going to send you a referral? And it's like, I want to just know you. Again, so in the traditional system, like I'd be seeing 35 people a day. I have a panel of 4,000 to 5,000 patients, which again is unrealistic. I'm not going to know 4,000 people, 5,000 people like personally on any level. There's no doctor-patient relationship at all. And that's for the patient side too. It's frustrating. It's like, well, my doctor's never available. And it's like, I don't get to make my schedule. Someone else makes my schedule for me. And that's what I've hated too in the past, where like friends were like, well, I tried to call to get in. It said you're booked. So I went to the urgent care. I'm like, no one even told me that. Like I would have stayed late to see you or something like that. But it's like, you don't get to control your schedule. And I hated all of that kind of stuff. Where like, you're just like a employee and it's like, but it's like, I don't know. I'm like, it's just a bad system. But
that comes with it.
Yeah. So my whole focus in my clinic though is more of like, again, I want my patients that's out there. I'm like, if I saw you 5 years ago, even like 10 years ago, like, we could have saved you all of this hassle and all the costs, whatever it is, like the sickness, the not feeling good, if I had just seen you 5 years ago and done like what I'm doing now, which is again, more people that I'm like are younger, healthier, or like they don't feel like they need to go to the doctor. I'm like, come on in and see me still, please. Like, let's at least do like your fully comprehensive blood work panel. I've been doing like almost 100 biomarker panel on everyone. And what's been surprising is that I've had a 50 or so like young, healthy people always feeling good. Only had one person have a fully normal lab panel. Like everyone has something abnormal, and it's better to know that ahead of time, and it's cheap to do that ahead of time. And again, I can save you all the hassle and everything in 5 to 10 years.
Opposed to waiting to get there and now it's too late kind of thing.
Yeah.
So obviously you've opened your own practice, which is called Members Health Co., which specifically focuses on direct consultation between you as the doctor and patients, eliminating administrative costs. Can you talk about this approach more and specifically the need for it here in Nashville?
Absolutely. Yeah. Well, so in essence, like, so in a traditional clinic, if I saw you as a patient, there's on average 14 to 15 other ancillary staff in between that encounter. So I would have to write the note, go to my office manager, then I go to the billing person, then I go to your insurance, and they go back and forth with like the billing other person. And then eventually you'll get a bill in the mail later. And there's like 15 people in the interaction. And that's why healthcare costs so much in America versus like my whole model is more of like a direct to consumer almost. I'm like, what if you just paid me directly? And it cuts out all the extra overhead stuff. So it's a leaner model. It is more of a, again, like direct to consumer. And I've loved it where I make my own schedule. I'm available for my patients whenever you need me, and like they call me, text me, and I'm there. So it's kind of again, having the access to your doctor too. Like you put me to work, like that's what I'm here for. I'm only taking 300 people. Again, so I have time to actually be there for my patients. And also, I don't know everything. I'm not going to pretend I do, but it's like, give me time. Like I have time to look it up for you. It's better than being like, I'm a Google search essentially for you, where it's like, let me check with my accredited sources, ask my colleagues, all that stuff. Or you need a referral or specialist. I'm like, let me call them. They're my colleagues. Like, and we can get you in, and it saves you all like the, oh yeah, my front desk will like send the referral at some point, and it takes forever otherwise. And it's like, no, let me just call. And if I have time to do that, yeah, I can do some really good stuff to keep you healthy. But that's kind of the premise of what makes it affordable and why I can keep my prices low, is because it cuts out all the extra overhead costs. And then also, like, since I don't take insurance, my pricing for everything is like the real price of stuff, which is very cheap. So like lab work. So if I got the same 100 biomarker panel, if I did that in my other insurance-based clinic, you'd get a bill for probably $2,000. And that's even with insurance, the best insurance. It's like, well, I've got insurance. I'm like, that's great. Rarely are they going to cover vitamin, hormone, biomarker testing. And that's what I'm doing to everyone. And it's like, you'll get a bill, but it's only $200, the real price. So that's my cost. Wow. And it's like, it's inflated 10 times as much.
Wow.
That's what I was like, again, I was like shocked. I was like, I knew it was inflated. I didn't know it was that inflated.
Yeah.
And again, having everyone have something abnormal, that's why now I'm on more of a mission to be like, okay, this is too much. Like, I definitely want to make, again, just spread awareness too of like, this is the real price, and like, come get it tested before, like ahead of time. Even like vitamin stuff, people are either taking way too many vitamins. I'm like, you're toxically high in this, like, stop taking all that stuff. Or it's like, this is an easy thing to supplement. But it's like, my biggest thing with all that is like, why? Like, why are you taking this? Why are you, whatever it is, anything in your life, even exercise-wise? I'm like, what's your goal with that? It's like, oh, to be fit. I'm like, great, let's do something, a healthy substitution where you're not going to hurt yourself. All that kind of stuff. But yeah, that's kind of been my model. And then in Nashville, though, especially where there's just so many entrepreneur, musician, entertainment, small business, people that are, again, either paying way too much money for insurance out of pocket or just don't have insurance and feel like they can't go to the doctor for that reason. And that's what I've loved with my clinic too, of like, no, please come see me. And like, this is way cheaper alternative, especially if you bundle with a catastrophic plan. Like, that's still cheaper than most insurance plans.
It is,
and I can keep you healthy. I'm also a whole pharmacy, like, for my patients too. And I thought with insurance, I was like, oh, okay, at least like a $10 copay for meds is probably a good deal, until I got again my prices, and I was like, oh, everything's like $1 to $2. And it's like, and also it saves you the pharmacy trip. I'm like, oh yeah, like I literally had someone this morning who was having a sore throat, came in, did a strep test on him, it's $3 positive. And then I was like, you need antibiotics? I'm like, here you go, it's $1.50. And then they left. And it was an easy 10-minute encounter. There's no copay, there's no billing, there's no fuss. And that's how easy healthcare should be. 'Cause I know them. It's like, once I know my patients, I'm like, yeah, what do you need? Like, I can get you in, and there we go. It should be convenient and easy. But that's why in Nashville, though, especially with so many people that are paying too much for insurance or not having it, I'm like, I'm hoping to scale up and just, again, more of a, like, there's options. Like,
yeah, absolutely. And not feel pressured. And I think like this too, because a lot of people don't understand healthcare either, because there's so many different nuances in it. It's hard to understand it all.
I think that's why health insurance has gotten so far away with all this, because it's like they keep it so confusing. I'm like, even I don't even understand the terms of it. And it's like, well, this is in network, that's out of network. Well, we'll cover this one, but not that. And it's like they change it every few months also, and it's just arbitrary. But yeah, I agree. They keep it confusing.
Obviously, it's clear that you have such a passion for helping people and getting to the core of people's issues and the root of it. Where does that stem from? Because I feel like a lot of doctors, and I could be wrong, but most of the time they're just trying to do their job, trying to get through it day by day.
Yeah.
Right. But for you, it's like you're alleviating all of that and focusing more on the people and moving out of compassion. So I'm just curious to know where that stems from. I feel like there's some kind of level of heart there that you have to have for people. So where does that stem from?
Absolutely. I mean, that's why I went into medicine too. Like, I love helping people. I also just love people. Like, I was a psychology major, so like, I love it. I'm definitely a huge extrovert, so it's fun. But it's like, when I'm in a 5-minute visit, I'm like, I want to talk about like your hobbies and stuff. Like, I want to get to know my patients too, and like, tell me like a cool restaurant in town. But again, knowing my patients now like that, I'm like, it's been great having more of like they feel like friends. I treat them like family, kind of a feel. And that's what I love doing. But I will say, I think a lot of doctors feel similarly. They just don't have this as an option either, to escape the system, so to say. And that's why a lot of doctors get really burnt out. I mean, I know I would have been burnt out if I took that kind of a job. That's why I knew that would be an option, because I'll create my own option. Because people are like, oh, isn't that scary? I was like, I'm more terrified of taking that job, seeing 35 people a day, than opening up my own business. Like, that sounds way more freeing, and I've loved it. I'm like, finally, I can do what's right. And I've loved practicing healthcare this way. But I think a lot of doctors, though, feel that same way. They just, again, they're kind of just, they are like pushing them to like see that many more patients a day, and they keep it very, again, like efficiency, and metrics and all this stuff. Where again, like the metrics, I'm like, what are these metrics even for? And it's all just from arbitrary, like, oh, look, we met our metrics and stuff. I'm like, but did the patient get taken care of? Like, that's what I care about. Like, I don't care about metrics and stuff at the end of the day. But I think a lot of doctors would love this model too. It's more just, again, giving them an option too. That's why I'm hoping to scale up too. And a lot of my colleagues I know are equally frustrated and would gladly switch over. It's just, I get it. It's a lot of work opening a small business.
So
that's why most doctors don't
of the
do
things
that.
you had to do to open? Because that's the thing, because it's not as easy as it seems like you literally crafted your own path. So what was it like to have to do that? What were some of the steps that you had to make
to do
that?
A lot of Google. I was like, how do I like file for an LLC? Like, what does that even mean? All that kind of stuff. But also it helped having friends that are small business. They've been so supportive and helpful. That's why I love the small business communities in town. And especially for them too, keeping them healthy. I'm like, please come see me instead of paying for insurance or just not going to the doctor. But because it's expensive to try to provide and like benefits benefits for employees, but I'm like, how is this benefiting them either? But no, I learned a lot just by doing, and I'm still learning a lot. Just kind of making
But
sure
you'll
I'm
be
doing it
glad
right,
in the
but
long run, you know?
yeah.
Yeah.
And that's why now if I'm trying to scale up too, of like, I don't know what my next steps are, but I will figure it out.
Yeah.
And I think someone told me to, like, for opening up a business, and like, if you wait till it's perfect, you waited too long. And it's
so
like,
true.
you gotta just go and start. And so that's why July 1st, I just opened, and it's been great so far. And then,
love that.
but I have a lot of fun, exciting stuff coming up too. Of like next month, I'm launching like IV hydration, just kind of Botox stuff. And then,
Oh, okay. Yeah.
well, with IV hydration, I feel like I see all these places popping up in town. And a lot of them, I'm like, you guys are giving like toxic amounts of vitamins like right into your bloodstream, and then people paying for them. Like, you're paying a lot of money for, you even know if you need that. Like, come get your labs checked. It's so cheap, and it's a few dollars to get vitamins checked. I'm like, come see if you even need that before you're just pumping it into your bloodstream. And a lot of them, it's like, yeah, someone in scrubs is giving it to them. Like, is there a doctor here? And it's like, oh yeah, somewhere in Florida or something, and they're getting all these peptides, and all well intentioned. Where it's like, I think that speaks more to like the frustration with healthcare in general, where you can't get into the doctor, but you go to the med spa because it's easier, convenient, it feels nice, but they don't know you. They're not doctors either. And it's like, so I'm like, there's definitely a need for people who want to do it. I'm like, fine, if you guys want to do this, I'm like, come do it the medically correct way. And at the real price, like a bag of saline is like $3 or $4. Not like, I don't know, people spend $100, $200 for that kind of stuff. And it's like, fine, if you guys really want to do it, like, come get it like the real way, and then like, see if you even need vitamins. If you do, like, we'll do the right amount, like a medically appropriate dose of it, not some like massive, I don't know, high dose. Again, right into your bloodstream is not, I don't know, people, again, it's like misled stuff too, where it's like a lot of information's out there these days too. Well-intentioned, but yeah, that's why I'm doing the IV hydration, not to like be a med spa, more of like, fine, people want to do that. I'm like, let's do it the medically correct way and talk about it.
So your practice has both a standard and premium membership plan. Can you describe what they both offer and the difference between both of those?
Yeah, absolutely. I'd say standard is more for someone that is young, healthy, already fit, eating well, and just kind of wants to, have a more comprehensive annual physical, and also like any urgent care issues at all or any minor health concerns, like call me, text me, like not planning to go to the doctor very often and not really sick very often, but still just in case, like it's like having a doctor in the family. I'm like, if something happens, like, you're going to want me, not like the best insurance plan. Like, I can help you navigate the system. Like, I can make a phone call and that gets you in. So someone that's just generally healthier, just looking for someone like just in case and urgent care stuff, and again, more comprehensive preventive blood work and everything. The premium is someone more for like wants personal health coaching, more of like, I really want to take control of my health and optimize my health. So that one I'm doing like more comprehensive blood work, doing more like personal health training and coaching. And I have an in-body scan machine, which is it's like a body composition analyzer. I used to be a personal trainer back in LA, so I've loved kind of bringing in some of the health coaching aspects of it too, and now doing the medical training and everything too. Like, I've seen pretty much every workout fad and trend long-term wise. So I'm like, okay, like that's great, fitness and stuff, but like, what's your long-term health goals? I'm like, if you keep doing that for another 5-10 years, like, you're gonna need a knee replacement or like stuff like that. I'm like, you don't need to. Those are really bad for your joints and stuff like that. But like long-term wise, it is. Which a lot of trainers don't get to see that part of it, like the medical part of it. Where I've seen people that come in their 50s with like really advanced arthritis, and it's like, we could have avoided this. But very much the preventive side too of like fitness and all that's great, but let's do it in a safe way. Like, no one needs to be doing crazy deadlifts and stuff. I'm like, you can just do a leg press machine. It's a way safer exercise. You're never going to hurt your back. Again, why would you risk it? If you're trying to win a powerlifting competition, great, that's different. But if you're just trying to stay healthy, I'm like, you don't need to do that. Like, you can just do things safe. But with the premium, I'm doing more of like more customized like programming, and then also like weekly food log reviews too. So really more on like the nutrition side there, just teaching healthy habits, and again, having time to educate and be available for questions, and more individualized care. So that's kind of the difference, where standard is more of like, I'm your doctor, whatever you need. Like, it's like having a personal doctor on call. And the premium is more of having like a personal doctor and also like a health coach, trainer, and like nutritionist in one.
You hear a lot nowadays about people stating, I feel like I go to the doctor and I get sicker, or I feel like the people at the doctor's office are trying to keep me sick. They're trying to make me more sick than I really am. Is that true? What is that? Is that really the truth? Is that people just hearsay, or like, what's that?
I think it's kind of from the patient standpoint. I'll do both, like the patient and doctor. Like, from the patient standpoint, it's like, I came in with this one minor thing or one issue, and then they only address some other thing and give me a pill for it. And it's like I went in with like, I don't know, ear pain or something like that, and they gave me like something like some medication for something else unrelated to that. And I feel like I didn't get hurt, and also they're trying to just push pills on me, and now I got a bill.
Is that the case though?
So that's the patient perspective of it. So the doctor
Okay.
perspective of it is like, I only have 5 minutes with you. I hear you, the ears hurting you, but I'm really concerned about your blood pressure, and here you are. That's my, if I have 5 minutes, it's all like playing triage. I'm like, I don't have time to even talk about anything else, but I'm like, don't have a stroke before your next follow-up visit. So it's like, again, it just kind of passes the buck along without getting to any real root cause of any of your issues, seeing if they're related, talking about lifestyle management before medication use. I always like a why with everything. I'm like, I'm not just going to give you medication because you asked for it.
Yeah.
Or something
Yeah.
that it's like, also, I'm not going to prescribe you something that I don't think you need.
Yeah.
It's more of like why do you want it, or why do you need it? And like, if you have a nice answer for it of like, for this, I'm like, okay, then now we can use a medication. Or same with supplements too. I'm like, yeah, if you are deficient in vitamin D, I'm like, please take the supplement. Actually, that's your why. Like, but it's like that's my biggest thing with everything. Even exercise too. I'm like, what's your why? Like, why are you doing crazy deadlifts? It's like, why? But yeah, in a 5-minute visit, I don't have time to answer, to even know you at all. So that's kind of what happens. Of like, it's like, your blood pressure's high, I'm giving you medication for that. Your ear, it's fine, and then I'll see you in 2 weeks or something. And it's like,
See, I'm glad you broke that down, because again, a lot of people don't understand that, which is one of the reasons why you open your own practice, so you don't have to work with just within that 5 minutes.
Exactly.
And you can talk about all the things that need to be dealt with.
I think it's more holistic in that sense too, of like more root cause analysis. And again, most of the time, if I have time, like, you don't even need a medication. Actually, it's like, oh yeah, it's this, and that's what's going on. Or like, let's look at your like logs and stuff with your symptom tracker, and like really get down to like what's going on. But it's having the time to have like a personal detective essentially, and like go through all of it and figure out what's going on, versus like 5 minutes. Like, I don't have time to actually think about.
You barely have time to even say hello.
Exactly. Yeah, I know. Literally. I walk. I'm like, okay, let's get to the point.
Yeah, yeah.
Or people have like a laundry list of things. I'm like, okay, pick 2, and then it's like, which I hate having to do that too, but I don't really get the choice in that kind of a.
And that's why a lot of people are like, I feel like my doctor's not hearing me. I feel like my doctor's not listening to me.
And they're not. But that's what they probably want to, but they can't.
Yeah.
And then we kind of get into that mindset too of like, okay, well, I don't know. The doctor is kind of checked out too of like, after seeing like, let's see, you're my 33rd patient of the day, I'm like, listen, I'm not really thinking about through all the options.
Yeah.
And again, I'm used to seeing sick people. So it's like, all right, we'll add another blood pressure medication on, and see in 2 weeks. I'm like, what if we did some lifestyle stuff? And if we looked at your food log, like you're eating a lot of really high salt, like we can cut that out. And maybe even just, again, the walking pad we're talking about earlier, something simple where it's like, you don't have to fit time in your day to go to the gym, but something simple. And you don't need medication. You can just control it lifestyle wise. But again, having time to educate and all that stuff too.
Yeah.
But I think a lot of doctors also don't know how to educate that way, because we're not really taught how to keep someone healthy. Is the other part of like the systems level part of it that I struggle with. Like in 11 years of training, we didn't have a single nutrition class, which tells you a lot about our healthcare system. No, the only reason I know about it is because I was a personal trainer, so I taught myself doing that. But most doctors, like if they didn't do anything like that, they were never taught. And which I think is, but again, that says a lot about our healthcare system of like, it's a very much reactive, like once you get sick, we'll fix you. But I'm like, what if we kept you healthy? It's so much easier. But that's my whole focus is that now of like, let's really talk about, like, I'm not insurance. And people are like, I have insurance. I'm like, that's great. I'm not that at all. Like, this is again, like a more to keep you healthy. And let's talk about it. In time, essentially, and access, all of it. But yeah, that's the interesting part of like, there's no nutrition classes, there's nothing. We just really much are taught like, this is the 3rd line medication for this disease. I'm like, this is the 4th line treatment for it. I'm like, again, like we could have just prevented it though. We don't even need to know that level of like, all right, we'll try all these medications and stuff. But I think that's why patients feel like they're just giving me more meds and stuff. And it's like, because a lot of time they waited too long also. And so when you're like, diabetes is that uncontrolled, you do kind of just end up having to do more medications and stuff like that. Or like Ozempic, like I hate that medication with a passion because it doesn't do anything for solving the problem. So what do
people need to know about that? Because I'm glad you mentioned with Ozempic and these weight loss drugs and different things that people are taking.
They're dangerous medications. That's what I'm like, oh my gosh, stop taking those. People take it so casually these days. And it's like, I mean, if you even think about the root cause, whatever, all of it, like for type 2 diabetes, it's almost entirely diet driven. And so that's how it works in theory is for people with diabetes. They stop eating. You pretty much get full and sick with Ozempic. So you can't eat as much, if at all, anything. So with type 2 diabetes, it's like, all right, you're eating really crappy food. So now you can't eat as much of it. You can only eat half of as much you used to eat. So your diabetes will be better controlled because you're eating less of your crappy food. And again, that does not teach anyone healthy eating habits, substitutions, all that kind of stuff. And as soon as they stop taking it too, they're going to go right back to eating the same stuff. So
absolutely.
It's not sustainable. It's not actually doing any education or really helping the patient for type 2 diabetes.
So essentially, it's just helping even people that maybe don't have diabetes.
Well, that's another thing. That's more dangerous because, like, if you don't have diabetes, you're already kind of eating healthy-ish. Now you're just going to become deficient in. You're going to be malnourished. You end up losing mainly muscle mass first, which over the age of 50 or 60, like you lose muscle, that's a predictor of mortality. Like you need all the muscle you can have. And then it's like you get deficiencies in vitamins. You end up getting like kind of the gaunt phase, everything, because you're losing all your muscle. Muscle weighs more than fat. That's why I love my body scan machine too. Of like the scale means nothing. Like, let's do your composition. Let's see like how much muscle you have, where it's distributed, fat, all that stuff too. And it's what's healthy for you is different from other people. But if you lost like 20 pounds on Ozempic and you lost 20 pounds of muscle, that's horrible. But what good is that? And then I mean, there's also, and it's like again, there's no long-term benefits there either because no one's teaching you about how to actually eat better, and doctors actually don't know how to do that. So all of it, I'm like, and people are putting a lot of money, like thousands of dollars on it. And like, for what? Like, you're killing yourself doing it. And it's a lot easier to just come on in and like, let's talk about healthy ways that we can make you healthier, lose weight naturally and sustainably, and you'll feel a lot better. On Ozempic, you're going to feel like crap. So all the stuff with that, where I'm like, we're missing so much of the healthcare system of education and time.
Yeah. So obviously people need to come and check you out and they need to go to your website. So where can people find out more information about Members Health Co. and sign up? Because you say you're only taking 300 members, right? So is there enough space for people still?
Absolutely.
Okay.
Yeah. And that's so it's on the website, membershealthco.com. You can also enroll on there, make a consultation visit. It's free. Just come in and see the practice. My background is also interior design. So I've looked I designed it myself, made all the art in there. And I'm like, again, I was like, why does the doctor's office have to be this sterile? But I'm like, I don't want to work in that. Again, as a patient too, but you'll see on my website and stuff is definitely not what you'd expect a doctor's office to look like, and in the best way. It feels very much like a nice lounge, and there's no rule saying a doctor's office can't look like that. So I'm trying to challenge that aspect of healthcare too, of like, they can look like this, and it's nice, and it's like inviting and warm, and not just the classics like sterile, like, I don't know, waiting room feel. But my website has more information. I also have an Instagram, which is also Members Health Co. And then I'm only taking 300 people, but like I said, all my colleagues are equally frustrated. Once I get to around 150 people, I'm going to start looking for the providers to bring on board, and kind of scale it up too. So there's definitely no shortage of providers. It's more just like, come on in and let's keep it growing. And again, there's options like.
So from everything, like from where you first started, the beginning of your journey in being a physician. Well, I'll even start here from going to college to now. What are you most proud of about yourself?
I mean, honestly, even just opening up this business, I feel like it's like the summation of like all my different like skill sets. Like I'm also a realtor, and like I also do like design, I also do all that stuff.
So you're a jack of all trades.
A little bit.
Do you even sleep?
But, 8 hours at least. Like I get my sleep. I'm a grandpa.
Me too. I have to have my sleep.
I have to have my sleep, or I'm not a nice person.
Either.
But no, I feel like this was a nice summation of like all my different experiences, all my different like skill sets of like creating this business. And I've loved it, and it's been nice just like being received too, of people being like, this is cool. I'm like, thank you, because I love it, obviously. But it's been interesting too. I'm like, I'm not trying to sell people something. It's more of like, let me help you, please. Like, this is cheaper, it'll save you money, and like, come stay healthy. So it's more of like a social awareness is the concept. Like, people probably know of concierge medicine. That's the only model that's kind of similar, where it's like you pay, but those are more expensive. So you pay $10,000 a year kind of a thing. And it's definitely meant to be more elitist in feel, more elitist in just like, they're only taking 300 people and that's it. And they're closed for business. My thing is more of like, I want to make this much more affordable, fully price transparent, and you're going to get exactly what you want, no surprises. And then scale it up too, and not just be my one clinic and that's it. I'm like, no, this, especially in Nashville, I'm like, we can all stay healthy, and this is so much cheaper. Like, what are we all doing paying so much money for insurance? Granted, I mean, if you're older and you're going in and out of the hospital and stuff, like, you do need insurance at that point. But everyone else that's young and healthy, and it's like it's so much easier to stay healthy. And like so in our 40s, 50s, 60s, we're not sick. So that's my whole goal.
Thank you so much for your time today.
Yeah.
It was a pleasure having you. And for those watching today, make sure you go to the website on Members Health Co. To find out more information and sign up. So again, Dr. Rahul, thank you so much for your time.
Thank you so much for having me. And yeah, I'm happy to give a 10% discount to anyone that watches this podcast and wants to enroll through there. Just mention that you saw me on the podcast or heard me on the podcast.
Yes. So they have to say In the Zone with Chris Zander.
Yeah.
If they don't say that, they're lying to you. They're trying to get over on you.
Yeah. I'll keep that. I gotta be exactly this verbiage. Yeah, come on in.
Yeah.
And thanks again for having me.
Absolutely. And for those of you tuning in today, thank you for watching. And until next time.